right. Well, thanks so much for having me. I really love the mission of your organization, and I appreciate the opportunity to speak about this. It's certainly a passion of mine, and um, for um, working with an accountable care organization, an ACO, I became heavily interested in Guide because many of the patients that I support have dementia and rely heavily upon caregivers. So I'm always amazed with how many people I meet every day who aren't aware of this new program. So just for transparency, I do want to share that my organization, Kootenai Accountable Care, does partner with a CMS guide participant called Suresti. We've had positive experience helping patients and caregivers connect to these guide services, and today's presentation is not intended as an overview, is not intended to promote an individual provider. It's just really an overview of the CMS guide model and not an endorsement of any particular agency. So what I wanted to start with was just how much dementia is affecting people in Idaho. What stands out to me is not just the number of people living with dementia, but the number of caregivers who are supporting them. The guide model, Guiding an Improved Dementia Experience, is unique because it recognizes that if we support the caregiver, we're also supporting the person living with dementia. So these are some statistics with the from the state alliance, the Alzheimer's Disease and Related Dementias Alliance, some of the figures that they have in their strategic plan as well. So I think many of you are familiar with this, maybe not these specific statistics, but certainly we're recognizing this as an issue in our healthcare system. So, what is this and why should it matter? I think it's really important for us as healthcare providers to know that this program exists. So the Center for Medicare and Medicaid Services, CMS, has this 8-year pilot program called Guide. And, the goal is really to promote caregivers to be able to be more educated about what the disease process is, how to recognize signs of deterioration in their loved one, and how to ultimately try to keep their loved one in their home longer. These are some screenshots really from the CMS Guide website, which if we have time at the end, I could help you navigate a little bit. But this program is really identifying that dementias are becoming more of a public health issue, and we're recognizing that people are not having the quality of life that perhaps they deserve. And so I'm just really excited because Medicare has never really focused, in my opinion, so much on the caregiver. And this is really one of the first programs that is also providing some in-home care, and we'll get to that in the next slide. So it's really more than just a particular care program. It really has specific care delivery models as well. So again, the aim is to help improve quality of life, reduce strain upon caregivers, and delay institutionalization if possible. Knowing that those, I think, want to say, are important parts of our system and helping caregivers as well. So definitely not to diminish the fact that there are long-term residential care facilities. So this is some of the requirements of the providers or participants in the guide model. So there's a standardization of who is providing care, uh, what they're required to do and to have available to help support the caregivers. So we're talking about having trained care navigators that are looking at whole person care and having availability 24/7 to have the caregiver be able to ask questions and to receive some of the help that they may need. A lot of times families are going to know, well, what do I actually get? So with this particular type of care. And so what you can expect to receive, if you are able to enroll is to have a pretty thorough assessment, not only of the individual with dementia, but also the caregiver. So there's a form called the Zaret Caregiver Burden Assessment, and that, in addition with questionnaires about the patient's functional status, go into a schematic to identify, a level of severity of the caregiving needs, and that helps a person um, qualify for potential in-home respite services. Sort of the cutoff with the respite services, you have a fast functional assessment staging tool. A fast of usually 5 or greater is meaning that you may qualify to receive some additional in-home support, which is everything to caregivers, to be able to have potentially somebody come into the home and provide. Is probably the biggest carrot for people to want to go through the process of enrollment and assessment, for being able to potentially get, I think it averages out to about 4 hours a week, um, if you have a severity a rating, to be able to qualify for that. So who's eligible? You have to have traditional Medicare. So if you have a Medicare Advantage plan or are already receiving other services like hospice services, you're not eligible to enroll in the guide model. Um, so that makes a difference. Sometimes when people may be selecting, thinking, I know that there's insurance helpers in this organization. So, looking at reasons why you may want or not want to be part of a Medicare Advantage plan. And the patient can already be living in a long-term nursing home or at this point assisted living. That was something that was updated just in the last year. We're in the second year now of this model, and so there was a little bit too much of a muddy water between memory care and assisted living, and so that is something that has recently changed as well, but it's not reflected necessarily in this infographic. But understandably, it is intended to, delay people going into a facility. So um, we're going to dive a little bit more into what that eligibility looks like. Medicare has access to claims. So there's a lot of information that's housed in databases behind the scenes. And one of those is, what the diagnosis is at a doctor's office visit, at a hospital, at a clinic. And so oftentimes there's a 3-year look back period. And if you have dementia diagnosis, then CMS may have sent a letter, which I'll show you next, identifying that you may be eligible for this new program. They're also looking at different medications that are associated with memory loss that may have been prescribed in these claims as far as identification. I think what's important to know is that you don't need to already have a dementia diagnosis to qualify for the program, because through the assessments that are being provided, the thorough assessment process during the enrollment process, the guide participant is assessing that. So I know that's a barrier, certainly in our state, with a limited number of primary care physicians, and I think people with dementia oftentimes have a hard time, getting to the doctor, and so sometimes the dementia diagnosis is not on the patient's record, but the family, we're all seeing it, and so there are avenues to get enrolled without that. This is an example of a letter that should have been sent to people who may have had a dementia diagnosis in those claim look back years, that would have been sent in the fall. On the second page of this particular letter is a list of guide providers that may be serving your area or your state. So, there was an attempt to get this program socialized. I don't think that there was a lot of information from CMS that went directly to, doctors' offices and things like that. So, I mean, like I said, every day I'm talking to people who have never heard of this, and there's not like billboards for it that we're seeing, or public services announcements on TV. So that's why I'm so excited to be able to share this with you today. So in order to find somebody who's participating in Guide, I'd encourage you to go directly to the website. There is a map that I would not recommend looking at on the CMS website, because it really does not reflect the actual providers who are serving that state. So there are about 20 providers that are serving the patients in Idaho. Most of them are digital. There is one, as we call maybe brick and mortar um, organization in the Boise area, and so this is probably the best way to find a provider, or at least start to get acquainted. And it'll be interesting as you're talking about going to a conference, in the Denver area with your professional uh, organization and credentials, that there might be booths, at the trade show section for different guide providers. So, uh, any questions? What we didn't get into were some of the challenges and some of the other nitty-gritty details with the guide program, and certainly those do exist. So I'm happy to answer questions. I have people reach out to me individually to talk about our experience
It looks
with
like
the program.
Lynn has a
Lynn has
question.
one. Yes.
Okay, great. Hi, Lynn.
Yeah,
Oh,
hi Amy. I'm with Idaho Commission on Aging
yes.
and great program, and I liked great presentation as well. Can you tell me, do you run into issues with the availability of services that you're providing to caregivers? Like, hey, we have respite for you, but oh, there's nothing available. Do you run into that scenario often?
So far in our area, there has not been that issue in North Idaho with the organization that I'm familiar with working with. So there are different ways in which the guide participant or the guide provider, sometimes I call it a vendor. I mean, just as far as it's the organization who is billing Medicare and providing services to that caregiver. Sometimes that organization, may have their own staff who are providing that. Most often, they're probably partnering with an adult day health if that exists, right? That's we don't have that many of those, or an in-home care company. What I have heard is that there's a little bit less of a challenge in Idaho compared to other states related to the reimbursement for the in-home care. So far, I have not heard that as an issue, but I think there are a lot of people who are just not accessing it, and certainly it would present as a challenge in more rural areas where there aren't as many in-home care companies to be able to provide those services. So.
One more
Yes,
question.
potentially. Absolutely. Yeah, please do.
Um, Number of participants. How many participants do you have enrolled in your program?
Yeah. So it's surprisingly low. And this is something that they did some pre-work, some pre-piloting. So the program, the Medicare program started July 1st, 2025. There was a year prior where organizations who were creating new programs were ramping up and being able to do some test piloting, larger healthcare institutions. It's interesting that none of the major health systems in the state hospital health systems, I mean, have chosen to be a provider of this, due to a lot of the rules that exist. And so it's about less than 10%. So nationally, less than 10% of the people who are eligible for this program are taking advantage of it. And we're certainly seeing that within our own ACO, at Kootenai Accountable Care, where we're almost to reaching about 50 out of the 500 or so patients who we think might be eligible for this. So there's a lot of
Interesting.
barriers, for that kind of a time-consuming enrollment process, just socialization of the program, having doctors recommend it, and then just caregivers who don't have time to just do one more thing. So,
Right
And
on,
there
right on.
there is one more question in there, and
sure,
then
thank you.
we'll move on. And it's,
I
do
can't see the
caregivers,
chat from my end, like with my
that's okay.
presentation mode. So,
Do the caregivers have to be employed by a formal caregiving agency with a Medicare provider number?
okay, that's a great question. So, um, the caregiver who is connected with the patient should be an unpaid caregiver. So the guide model aims to promote the patient who has Medicare, who has a dementia diagnosis, and whomever they identify as a caregiver. That could be a daughter, that could be a neighbor, that could be, somebody who is they're the one who's getting that education. So um, the caregiver who may be providing respite does need to be um, affiliated somewhat officially with the guide participant because it's kind of a subcontracted type of service. And I do believe that there is some kind of form or process to have that be documented at the CMS level. So I hope that answers the question,
All right.
Well, thank
depending
you
on how
so
it was
much,
being asked.
Amy.
Thank you all.
It was great.